Welcome to our continuing series, Interviews with Disciples and Devotees. We are pleased once again to have Dr. Pachegaonkar with us. Namaste. Last time, Dr. Pachegaonkar spoke on osteoarthritis, and today the subject is rheumatoid arthritis, a very big subject. I'd like to begin just telling you an experience of my father, because this is so unique. It became so bad that he was confined to a wheelchair. And a relative of ours, her uncle or father, had heard about a doctor in Mexico who had this extraordinary medicine that could cure rheumatoid arthritis. So I said, well, we'll take a chance. My father was in his mid-70s, still a very strong man, so I took him there. We flew to San Diego, then to this place in Mexico. Made an appointment, of course. And when he went into the doctor took x-rays, and then he said, I can help you. He gave him, on the way, the curbs were that high from the curb to the street, and I had to practically lift my father over them. We had wheelchair up until a certain point, and then I had to walk him. So this doctor injected him with this long needle, I watched it, 4 times in the neck, and gave him tablets, which I later heard had come from France. 15 minutes after the injection, my father was walking like a young man. And for many years, I kept doing that, back and forth, till he was about in his 83, 84. Then I was looking up, and I saw something from a physician company made of all of doctors. It was called GS 500, and I sent him a bottle of it. A month later, he writes to me, I have not taken that medicine from Mexico anymore. This GS 500, glucosamine, is working fine. He had 10 years of good life from that experience. I'd like to know what you have to say. It's so interesting.
Basically, rheumatoid arthritis is like autoimmune disorder. The body's own immune system starts reacting to own healthy tissues. And then the joints are inflamed, they are painful. Generally, it is seen in middle-aged people. Around 40 to 50 age, they are most affected. Usually, it is very insidious onset. Like it doesn't have like sudden onset. So insidiously, the patient goes on getting like vague muscle pain. But the characteristic is the pains are worse after rest. The initial movement after rest, either after sleep or even lying down. The initial movement is painful. Mainly the wrists and ankles are first affected, and then it leaves the deformities also. So it's a very chronic disorder, but because it is autoimmune, it's not like infection coming from someone else. The orthodox system says it is almost incurable. And with this presumption, they adapt some methods called as disease modifying practice. So they give certain drugs like long course of quinine. They give in rheumatoid arthritis conventionally just to retard the progress, but it's not a curative. So very approach itself is something pessimistic. From homeopathic point of view, it is some delusion in the system which provokes this sort of autoimmune phenomena in the person. It can be at deeper level, vital level or mental level, the aberrations occur and the person develops this sort of autoimmune disorder, rheumatoid arthritis. That way it is safe. It's not like immediately life-threatening, though there are secondary effects which really affect the quality of life as well as the life duration also. But in natural course also, body has a spontaneous, potential where if it is roused, body can definitely modify the disease condition and there would be regression. I can quote a very interesting case from my practice. A young boy, he was around like 24, 25 when he was brought to me. But he started having this rheumatoid arthritis in acute form somewhere at the age of 19, 20. So he had to abandon his studies. He was studying in diploma course in civil engineering and he had to abandon his course. And for 4-5 years they tried everything, and when they realized that the conventional school doesn't have any treatment, his brothers approached me. And we started taking his case. In homeopathy, we don't treat the disease in that sector. We treat the whole person as a whole who has come down with this illness. So we were treating, and he was like almost 80% better. So we allowed him to go to his house and even take up some studies or work. And in that course, he developed what we call a perianal sinus. It's like pus-like discharge from one opening near the anus. And then he thought this is something odd, so he approached one local doctor and he again sealed that sinus. He drained it properly, sealed that sinus and dressed it with something, and it was cured. And again there was relapse of this rheumatoid arthritis. Then we also were wondering why should there be relapse. Almost like 1 year he was perfectly fine. No painkillers, nothing, no inflammation he was working about. And then when we probed that this was the incidence he quoted, that he had this perineal sinus for 3-4 months. So he was not able to come to us for this minor complaint. So locally he managed it. He is from about 60 kilometers from our place. Then we warned him that sometimes body finds out such vent or what we call a modified form of the same disease. Because there was no apparent reason why he should develop perianal sinus. And then I told in further course, if you develop this site of complaint, don't take anything else. You have to be on only homeopathy or no treatment. You just go ahead with it. Carry on. And this way we started again treating him for this rheumatoid arthritis. Again he started responding well and he did develop that perianal sinus again. And when we got it examined, that instead of sinus now it was fistula because another opening was opened. So he developed this perianal fistula and we started again treating on the same totality basis, which fistula, sinus or even the rheumatoid arthritis is a component.
But the whole being
Continue
treating.
And then
not a specific
so he started improving and then the fistula was allowed to flow, and in due course it took about 2 years for us to get rid of that fistula, but spontaneously that fistula got cured. And now this boy is around 40 years now. Later got married, rehabilitated, is working as civil engineer and he is working in the field, though he has some deformities because that physiotherapy he couldn't take. Finer deformities are there, but absolutely no arthritis. absolutely no arthritis. And then his knee joint was weak, so someone suggested, why don't you take knee replacement for this? This is too much damaged. When he phoned me recently, that see my knee has been damaged, they say then it has to be replaced. And when I suggested, ask them, you just go with the other joint and ask them which doesn't pain. And when he went with that joint, knee joint, they said, oh, this is worse than that. That also has to be replaced. So he is totally rehabilitated. So this happens. That there is, and when we presented this case to like local physicians, they said, oh my God, this is a wonderful case of spontaneous regression of pathology. And that is what we say, that with homeopathy, this sort of potential of modifying, because whatever, see, medicines also how they are invented, because physiologists have studied and there are certain chemicals which are released when this sort of crisis is created. So all these medicines which work as disease modifying agent, our body has potential to produce these type of reactions. And body has. So many times we have seen that like eczema, you start treating rheumatoid arthritis and some sort of skin lesions come in the form of eczema or psoriasis. In some people we have seen that the ulcerative colitis and rheumatoid arthritis, they alternate. Like if rheumatism is suppressed, then the colitis comes.
I see.
And when colitis gets suppressed, the rheumatism comes. So these are all the dynamics at deeper levels in the body. Even mother has said in one different context that there is no illness which is not cured by divine grace. That means there is a potential in our system given by the divine, granted by the divine. Only thing is we have to just avail it or utilize it. So physician's main role is in helping the patient to avail this potential for spontaneous regression. And this is the best approach even in rheumatoid arthritis. That if patient's own health is balanced properly, then the system will develop a phenomena, and definitely this autoimmune phenomena will be controlled.
So back to my father now. What about this glucosamine? It helped him so much.
No, that is what. These are all what we call stimulants for such regression. Because these stimulants create an environment where body develops a sort of awareness. Because what is autoimmune phenomena? It is delusion. Our own body starts developing a phenomena against own body parts. So this is under delusion. And the very awareness itself will resolve. So maybe these injections every time were stimulating the better awareness in him. And in turn it must be curing.
But it was his own consciousness working in the body.
100%.
I see.
Because now by recognizing the AIDS, this HIV virus, HIV, now we realize that our own immunity is the first thing which contributes in cure. Without that you can't.
I see.
So our approach has to be in stimulating that potential in the person to overcome the pathology. And this approach helps in malignancy, in rheumatoid arthritis, or even any autoimmune phenomena.
So all that Mother and Sri Aurobindo have written about the body consciousness,
Yes.
it's right before us.
Yes. And Mother has categorically said that physician's main role is this, that you must make the person open to the grace. What else it means? But divine has already granted this.
Yes.
The possibility is there. Only thing is the person has to be open to it, and physician's role is like catalyst.
Wonderful. Excellent. Thank you so much. What do you feel? Is there more on arthritis to talk about, or we do another subject next week?
Another subject would
Very
be
good.
like.